All right, we're at the last session, and it's certainly my pleasure to introduce our keynote, but before I do that, maybe just to remind our online audience again, and I'm sure you know this by now, there's a Q&A section where you can actually type in your questions, and that will be monitored by Nick, and after the keynote address, we'll field questions from the online audience as well as from people in the room. So without further ado, let me then proceed. I'm certainly happy again to introduce Dr. Chikwe Ihekweazu, and he is currently the Assistant Director General at the WHO, where he leads the WHO's Hub for Pandemic and Epidemic Intelligence, and this is based in Berlin. But I actually got to know him in his previous job, and that was as the Director General of the Nigeria CDC. And prior to that job, it was in fact Chikwe that held the government accountable to remind them of the need for a national entity that can devote its attention and its time and resources to managing infectious diseases within Nigeria. And it is then with no surprise that he was sought out as that exact person to do that. He certainly played a central role within the country, within that portfolio, to lead the responses to a range of disease outbreaks, which then also led to when COVID-19 was declared a pandemic. But his training, in fact, goes back, and he obtained his medical degree back in Nigeria. He then moved on to Germany and then did his specialization, his clinical specialization, right here in the UK. So he's come home again, but you can't keep him here, by the way. You've got to send him back again. And through this career pathway, he's got about 25 years of leadership roles in public health. And he had time that he spent in South Africa, where he, in fact, implemented a integrated surveillance system for tuberculosis. He spent some time in Germany at the Robert Koch Institute, and then also he had time here at your UK Health Security Agency, and I believe that name has changed a number of times. I'm not sure what it was, the name when he was there, but yeah, he certainly spent time in the UK. But I think what was characteristic within these portfolios, and people have commented on this both in the public space as well as in the private space, was his ability to neutralize tensions in order to rally communities to remain focused on dealing with the public health crisis at the time. And so I'm sure he's got no crisis at the World Health Organization, but that talent, I think, is really being something that I think will stand him in good stead in his portfolio now, where he is dealing with a regional body that is really looking at pandemic intelligence and his role in Berlin right now. And so, Chikwe, it's certainly a pleasure to welcome you to this event, and we look forward to hearing from you. Thanks so much.
Thanks, Alan, for the intro, and really good to be here. I just spent some time looking at some of the posters and feel significantly illiterate with the amount of science going on, and very grateful to be able to be part of it. I'll just share a few thoughts, but I was really struck by the last panel, and especially with the number 6. If you remember, those that thought that we are going to act on the lessons learned from the pandemic. And I hope that I can share some thoughts of some of the things that we're doing that I think is acting on some of the lessons, definitely not all of them. And I hope we can raise that number to at least 7 after the talk, hopefully a little bit more. But I was just speaking to Nick just coincidentally, and he didn't know what I had on my first slide. But I think this is a thought that probably is on all our minds in terms of how do we keep the momentum. With the work everyone in this room has contributed to in one way or the other, we're all seeing, I wouldn't say a reduction in interest, but a growth in interest and other challenges around the world. So how do we keep some focus on the issues that we've all been speaking about collectively? And it is hard. Sometimes we think the issues that we care about are the most important. And if I look at the itinerary of the DG of the World Health Organization and what he has to deal with every single day, right? It's hard because there are, and this is just a small collection of what's going on. It's hard to keep the focus when almost every single day, every hour, you're confronted with new challenges. Some of them are, probably avoidable. Some of them are not. Some of them are primarily health crises. Others are humanitarian crises that have a big impact on health. And some of them, like a country in Northern Africa at the moment, is just when two men decide to take a country 20 years back for all sorts of reasons. And all of them have significant public health consequences that we then have to react to. And it takes up a lot of our time. At the same time, we've all been working in this space one way or the other, in the intersections between public health and science and academia. And that term, surveillance, means different things to different people and different groups. And when we talk about it, obviously we all have that prism that we are looking at it through. And it's always important to think about what is the purpose of what we're doing, which are all legitimate. And sometimes we're doing them in parallel, sometimes they're intersections, but those intersections are not always obvious. So whether the detection of new diseases, and when we think about improving surveillance, everyone often thinks about just the detection of emergent threats. But all the other needs of data for decision-making through the pandemic, how much do the traditional concepts of disease surveillance, of counting cases and deaths, really enable the decision makers that our leaders had to make? We saw the impact of monkeypox as became a global issue. It definitely wasn't the first time it had emerged in the last few years. How much does surveillance in one part of the world and our responsibilities to it have an impact on the rest of the world? How do we take those things seriously? But also, I put this one on measles there because it's just important to remember, because sometimes we focus so much on surveillance, on detection, and here we have a disease for which there's generally good surveillance, the most effective vaccine we know, and still it's a problem in many parts of the world. So it's always still to remember that the emergent part of our work is not the only thing that is necessary to do. And then obviously we've seen the opportunities around new options around wastewater surveillance and how that has changed some of the thinking around polio, and probably will have a much deeper impact on many other diseases. So this is really to think about, are the traditional methods and tools we had for surveillance and we have thought about sufficient for decision support as we move forward? This is the slide that we in WHO have presented on COVID every week for the last 3 years. It's fairly simple. It gives you time trends, cases according to regions, gives you a grossly oversimplified image of the pandemic. But everyone in this room knows that there's so many other factors that have driven our understanding of the pandemic, on the causes on the issues driving it, on the impact it has, from economic factors to factors on the environment, to the health system, right? When I working in Nigeria, like Alan said in the beginning, we got questions on health systems data that was relevant for our leadership to understand what to do. And, I don't know how many countries have that, but, I couldn't for many months tell my minister how many severe cases were admitted in hospitals in the public sector in Nigeria at any point in time. We just did not have the connected systems to be able to do that. And of course, this drives the response. I couldn't tell him at the beginning of the outbreak what our passenger burden through international travel was into Nigeria. And there was no way I could access that data. So, and all these were data points he needed, or they needed, to make big decisions. And these are not decisions I could tell him, sir, I'll come back to you in 2 weeks' time. He wanted to know, do I close the borders today or tomorrow? And what impact will it have on this new emergent disease coming into our country? And to do that, I needed access to many of these data points that we simply did not have. And many countries didn't have, even the more advanced ones. So, and is this part of surveillance? Or if it's not, should we at least, if we don't have access to it, should we be connected to those that have access? And should that be in a systematic way or not? And these are the questions that have been simmering, but we now have to answer if we are to at least start acting on some of the lessons and to increase that number from 6. But at the same time, there has been some incredible innovation happening. I got my team to look at new GitHub is a repository for, many people here probably know, new methods, technologies in the open source environment. And maybe this is driven by people having to stay at home during the pandemic, or free time by data scientists normally working in big tech industry. But suddenly there was a whole plethora of new opportunities placed on GitHub, new publications in PubMed on new methods. And so there is the innovative side driving the back end is happening. But somehow there's a gap between innovation, science, to public health action. And as much as we hope that somehow trickle down or trickle up will take us forward, I don't think pandemic preparedness can depend on that. So we have to think of how can we be more intentional in bringing these together for us. So the key question on our minds at the moment is, how do we maximize the opportunities from this science innovation to mitigate future risks while building capacity and collaboration? And when we think about this, and I'll come to this a bit, the capacity development bit, whether it's new science, new investments, new technology, new people, seems obvious. But the hardest part is the collaboration. And somehow we hope it would happen on its own. But it doesn't sufficiently. And then when we think about why it doesn't happen, we think about outliers. In the global space, we naturally start thinking about countries that for some political reason are not collaborating with each other. But then I asked the hard, apparently simple questions. I'll use examples from my context because it's the safest. How much is Nigeria collaborating with Togo, Benin, Niger, and Cameroon, our 4 neighboring countries, in anything on public health? Probably 0. We have no political differences. There's no disagreement. We're neither facing east nor west. These are countries in the same geographical zone with the same risks. But there's very little collaboration happening. Now, maybe you can all think about your own context and your own countries and your own neighboring countries and see whether you feel confident that enough collaboration is happening between the countries you're working or living in at the moment and the country next door. Probably very little. And so our new division in WHO that I'm privileged to be leading is trying to do something about this. So our vision is a world where collaborative surveillance empowers countries and communities to minimize the impact of epidemic and pandemic threats. And unlike the thinking around the work we're doing, we're not creating a new hub, we're not creating a new data hub to collect data ourselves and tell countries what risks they're going to face. Rather, we want to catalyze that transformation to happen at all levels, especially in countries, by connecting. So rather than the notion of collecting and answering, really the notion of connecting in different ways, innovating and strengthening capabilities. And we're going to do this through the different ways on those slides. And this has been the output of a almost transformational process that's been happening in the last year to define what exactly the gaps are, and not jumping just on the traditional approaches normally of just building more, throwing more money at it, employing more people, and doing the same things we've been doing over and over again. So we believe that a lot of the capacities that we need out there are out there, and a lot of the work we need to do is around connecting them and building better collaboration. Yes, there's an innovative part of a lot of what we need to do, but critically, not to forget that we will work on the investments that have been made already, and many countries have built fairly complex surveillance infrastructure, and at the moment are even doing a lot more to strengthen them. But this is kind of an image that we use to hold ourselves accountable to what we're trying to do. So if we think about an optimized state and what we need to get there as a conceptual framework, yes, there's a lot of capacity development that needs to happen, and many countries need to do a lot of this. But how are we intentional in building this? Because if we focus on, and this might be a sample country that has invested and has all the capacity, but lives within an environment that is not collaborating with countries around it, then it has distance, it still has a huge way to go to get to that optimum state. And so it is this really figure that keeps us thinking every day on each new project, each new initiative, each new idea. How are we not only building capacity in human resources, technology, innovation, science, how are we also making sure that the individuals, the institutions, the countries are collaborating in order for us to get further up towards an optimum state? So this is just the configuration of the new division in WHO. So we sit within the emergencies program, led by Mike Ryan, who some of you would know. And previously was made up of two divisions of preparedness and response. And now we have a new division for intelligence and surveillance systems, which I lead. And these two departments in Berlin make up what is commonly called the hub, or what we call the hub. But recognizing the need to build on systems that exist already, we have a department in Geneva that's in parallel, because we can't all focus on the new shiny object. We also have to make sure that the colleagues working on surveillance systems that still exist remain the backbone on which we build, rather than think of this as a completely new concept. And you can see that there's a big part of the work that we'll be doing that will focus on genomics, analytics, and everything it has to offer the public health space, and I'll come to that in a bit more detail. So the work, I don't want to go into all of this, but this is just to show you the range of projects, initiatives that are ongoing at the moment that we've started, which fall in different, you can cut this pie in different ways, but we've done this in terms of norm standards, capacity strengthening, those that relate to services, and those that relate to strategy and policy, where you see something we've highlighted called the International Pathogen Surveillance Network that I'll spend a few more minutes highlighting. But before I go into the genomics bit, I just wanted to highlight 2 projects just to illustrate the different angles on which we're coming. There's one of them is called EIOS, the Epidemic Intelligence from Open Sources. This started as a small project, but coming into the hub, we've enabled it opportunity to scale. And this is really utilizing epidemic intelligence from anywhere, so from any open source, and aggregating this. A lot of this uses artificial intelligence from at the early stages, and we are continuously optimizing the algorithms to make sure that to enable better specificity around either pathogens of interest or events of interest in specific geographies, expanding that, narrowing that, so depending on who is the user. So this initiative, as we call it, is growing. There's growing interest around the world, and we're now expanding that a lot, and it requires a lot of 2 things. Firstly, investing heavily on the technology side of things, but like all our projects, has a big community aspect to it. So nurturing, building the community to support its growth, its utilization, and how information there generated from this source is then verified, and how that verification happens based on what criteria, and how that then leads into alerts that are generated and then lead to public health action. So none of those systems on their own has sufficient information to define specifically that this signal ultimately is an alert that requires a response. Still requires a lot of human intervention in making that decision making, but AI and various opportunities for optimization help us in narrowing the time and effort required to do all of that. The other fascinating project at the moment is something we've called the Collaboratory. It plays on the words collaboration and laboratory. And this really is to pull together, whenever there's a crisis, there's a lot of innovation on new tools, new methods, new people working together that normally don't work together because everyone is focused on the crisis. And immediately after the crisis, people just tend to wither away back to whatever keeps them busy day to day. So the Collaboratory is a new initiative to try and develop a framework to keep both the tools and the communities somehow connected to each other and within each other. So there's firstly a huge piece of work in building the technology environment where this can happen optimally in an easy way for users. But secondly, a lot of community building, communities of practice and the digital environment. So both are important in enabling this to happen. None of this would happen if you focus on one or the other. So as much as a lot of the work we do is on the digital environment, and that gets a lot of attention, the actual man hours on each of this is often spent in building the communities that will enable this to grow and thrive. So I'll spend the last few minutes on one that I think might be specifically interesting to many people in this room. It's a new initiative called the International Pathogen Surveillance Network, and thanks to many people in this room who have contributed to this in one way or the other. But the beginning of this is really to recognize that even at the moment, even with the massive growth of investment, interest in pathogen genomics, a lot of it is still not optimally deployed to avert epidemics. And I think many people in this room will agree that capacity in countries still remains very uneven, very uncoordinated. There's lots of innovation happening, but a limited sharing of that. So many groups are reinventing the same tools in different countries, in different academic groups. And really data sharing is beset by many problems. And some of them have become more obvious in the last few weeks. Some of them are technical, some are political, some are bureaucratic, and some are just, what they are. But we have to deal with all of them, irrespective of where it's coming from. But the impact is decision-making will be hampered, is being hampered, and the potential opportunities might not be fully realized if we don't do something about all of this. So at the back end of that, sometime last year, early last year, a new genomic strategy was developed by WHO with contributions from all of you in the community with these 5 core principles: to improve access to tools, to strengthen the workforce across countries, across the world, to enhance data sharing, to maintain a readiness posture for emergencies that came up in the panel, and to maximize connectivity for timely value addition to the public health surveillance architecture. So all of this has led to the establishment and development of this new network. And the idea of this didn't come from WHO. The idea came from colleagues, primarily out of the G7, but driven by a colleague with whom you're all familiar here, Jeremy Farah, and others, that called for what at the time was called a pandemic radar. That term has evolved into what we're now calling the International Pathogen Surveillance Network. And the thinking is basically, how do we use all this momentum around genomics to really drive what we need to do sustainably into the future by facilitating coordination between countries across the world, different partners, to bring academia, government institutions, financing bodies, the private sector, into some form of collective network, recognizing that all of them are important and none of them on their own can really take us forward. So the sweet point really is at the intersection between all of us kind of generally working in this space. So not an easy thing to do, and we've been working on this and getting it started for over a year. But we're finally at the stage where we're about to launch this new network. And we've stated a vision where every country has equitable access to sustained capacity for genomic sequencing and analytics as part of its public health surveillance system. This part of doesn't mean that it has to be in it, but it has to have access to it. So if the colleagues working on genomics in country X that are not part of a national public health agency, that's fine. But as long as you're working together, you have a framework within which that collaboration is happening. And so we hope to be able to create a mutually supportive global network of genomic surveillance actors that amplifies and accelerates the work of its membership to improve access and quality. And so you again see all the emphasis on the intersection and collaboration that we need to happen. So I won't go into all of the detail, but just to show that these are just different groups of colleagues and institutions, and you can see the different sectors represented as best we can. How are we going to do this? We hope to create communities of practice around specific areas to support countries in scaling up through a country scale-up accelerator, do a few small grants with our partners on the philanthropic side, and not to become a big grant-making organization. That's definitely not where WHO's strengths are. But to make sure that if we need more equitable participation in communities of practice, if we need more countries to be able to do what they need to do to keep the rest of the world safe, then we need to also enable them access to some funding, at least to start moving in that direction. And then some things we have to do collectively. The advocacy work that we all need to do collectively, because if not, the interest that we have generated on this subject matter that we are also passionate about will inevitably disappear because of the things I showed on the first slide, because the mental space available to our leaders are preoccupied by other important challenges that they also have to devote time to. So it won't happen on its own if we're not doing the advocacy bit well. And then to explore with ourselves, yourselves, the entire community, on what is a global platform for this space? So is there a need, an opportunity for everyone in this room to come together with other players, with those that are working on the public health side of things together, those working on philanthropy, so where we can have a global annual or biennial forum so that we can define for ourselves across the various components of our work what needs to happen. And we then hope through all of this we'll have better harmonization of effort, we're able to scale, work more efficiently with each other, we're able to sustain political attention, and through all of that, we hope at the end of the day to have stronger national and international surveillance systems that will detect, characterize new threats, and enable us do informed decisions, make better decisions. And if all of that works well, we have better tools, there's more efficiency, more resources. We hope that all our systems are more interoperable. We can do higher volume of detection and sharing. There's more capacity globally. And ultimately, if we do all of this right, we hope to save a few lives in the long term and have economic benefits for our country. So this is the theory of change. It's hard, and I'm sure there'll be some skeptics in the room, that's natural. But the issue is that if we don't find these ways of working together, and if we're only focused on that work we are doing in our lab, in our institution, which is obviously very important, and if that preoccupies the entirety of our work, we will not be able to, we will end up in a similar panel whenever the next pandemic happens and ask ourselves what we did not do. And it's in order to avoid this situation that we have to devote some time, not all of our time, but some time to the building of these kinds of networks to enable a framework for the work that happens at the intersections to happen. So it's been quite a process, building the community, assuring everyone that their interests will not be undermined by working in a network, that all the specific interests that we have individually in our groups will not only be sustained, but will be amplified through an opportunity for collaboration. And so we're finally at the point where we can start doing the actual work that we need to do. And we're launching the network on the 20th of May, just before the World Health Assembly. And as you can see from this is just the initial group of partners, friends, institutions that are part of this. And this will expand. We recognize that it is at the moment not equitably distributed, if there's anything like that around the world. But you win over one institution at a time, and hopefully in the next few years, this global map will be a lot more covered by the time we get to work. So we're launching on the 20th of May, on Saturday, and you can find more information, and if you want to hear more and talk about it and think about the potential for the future, please check our website or reach out to me directly. But the key thing here is really to remember that it takes all of us working together, and all aspects of our work, it's important. And just being here, not attending the full conference, but at least yesterday evening and today, and speaking to many colleagues, I realized the extent of the science happening, the extent of the opportunities, but really it's how do we maximize the opportunities within a terrible context of a pandemic, and see how we can work on our individual projects, but also find the opportunities to really work together. So thank you very much, Alain, for this, and for all of you for listening. The question.
Yeah. Thanks very much, Chikwe. Yeah. We've got time for questions. So, Chikwe, maybe let me just check if there's any questions online.
Not yet.
No. And so, maybe I got two questions for you. I mean, the one maybe a bit easier to wrap my head around than the second one. So the first one, you had a very busy slide about projects that you were doing.
Yeah.
And the one thing that I was looking for there is this role of public-private partnerships and reflecting on what happened during the pandemic is to see the value add in that. And I'm just wondering, where does that slot into that maze?
Yeah, I'm just going back to it slowly.
Yeah, there you go.
So, we recognize, like everyone through the pandemic, that working with the private sector is really important in the work we all do collectively. Now, there are, in WHO, there are limitations that we have built into our governance environment that makes that collaboration not always as easy as it could be, but for good reasons, because being a member state organization that has been set up by our countries collectively, there are barriers to entry in terms of that relationship to make sure that there's no undue influence just by being successful in the private sector. Having said that, in this particular space, or in many spaces actually, we've also seen that despite all of that, we cannot really make the progress that we need to make as rapidly without the private sector. So we are at the moment thinking about how to make that possible. What are the governance arrangements that are required to enable the protection, but also enable the ease of access? Having said all of that, one of the reasons of working in a network rather than the IPSN that I presented being completely hosted in WHO is also to make sure that there is access through partners in the network to support through the private sector in different ways, depending on what relationships can be worked out. But I think, just to throw the question back to you and maybe the audience, I think this is just working with various components of the private sector is one of the acute challenges that have become obvious to us through the pandemic. But it's that intersection. It's just the private sector is one of the harder ones. But if you think about the collaboration within those for which the barrier to entry is a lot less, how well are we doing that? So I think all of us have to really think on where the resources that we need are and how can we deploy them to solve the problems. And what are the incentives for colleagues that have that expertise in working in the public sector?
Okay, we've got two questions. Let's take that too.
Okay, so Caitlin says, thanks for an amazing talk. What is the best way for an academic research group to get involved and contribute towards the IPSN?
Yeah, so I would just say reach out. There are quite a few already in parts of this. We have, also it depends on the interest. For instance, one of the first communities of practice, because there will be a number and depends on the need, is on data sharing. So the colleagues that are interested in that particular community of practice, and there will be others, can get involved in that one or others. So IPSN, the network itself will have a broad governance arrangement, but within it there will be communities of practice depending on specific areas of interest that require global collaboration and global coordination to optimize.
Okay, and kind of related to that, Coffee says, so if there are academic labs, working in pathogen surveillance, I don't know if that means data generation or data analysis, how can IPSN integrate these smaller structures, kind of distributed network, I suppose?
Yeah, I'm not, it's an interesting question. We're starting off, so we'll have to see where the balance lies. I don't expect IPSN to be the network to do everything, right? And there are probably many networks in academia, regional basis, that are still useful and will continue to be for collaboration. So the key thing for us is what areas of our collective work requires global collaboration and coordination for optimization. And so not every lab might need to be part of that global network for us to achieve our purposes, because we want to still be supportive to local, whether they're thematic or whether they're regional or whether they're national networks that have their own functions. And our goal is not to overtake them or to, to compete with them in any way.
Maybe as an extension to that, I think this is trying to wrap my head around this network of networks. The one challenge that we all face is network fatigue. I mean, let's be frank, right? I mean, we are all called on to do things with a very little time with the ease. And so I'm trying to think through how does the mandate or the mission become one that can take advantage of a higher level community than what we have access to. So, I mean, there was one of the mission or one of the deliverables is to be able to provide high level advocacy. Yeah. And that I can see that immediately. The community of practices, and we have quite a few of them here, right? We've got the TIFI Consortium, there's the PHAGE, there's the GA4GH, and so they go on. And I'm just wondering how communities of practice become communities of practice. And I wonder how we're going to trickle that down, because we all work in the weeds, right? It's in the detail that we operate. And so is the value add of IPSN going to be in the advocacy? I'm not sure where my head is.
No, I hear you, Alan, and I think we will find out as we implement which of these issues or which of these areas for which the existing communities of practice will benefit from a global community of practice, and probably not all, but there are issues. If you think about data sharing, for instance, that we've started, this is a global need. So if you only speak about it regionally, the capacities are different, the opportunities are different, and so the consensus was there's a need for a global space to have some of those conversations in a trusted environment before there's a crisis. But I agree with you in the concept that we will have to think very hard on what do we leave for wherever it's being dealt with, and which issues will benefit from a global approach. And this we would do collectively once we start. But we don't have a prescription now on which things we should have or not as COPs at a global level. And these are things that we will decide as a community.
There is a question here. Can we just take the one first here in front? We'll get back to you, Nick.
we might need to wind up. We might need to wind up. So.
Yeah, thank you. I agree with Alan about the kind of network aspect and thinking through things that need that overarching approach. You didn't mention too much about One Health. I wonder how much, because that really does need overarching structures, and I wonder where you saw that fitting in, or whether this is mostly human for now, or...
No, it's... I mean, it's everything we're doing is within the One Health approach, right? And the many actors that are already involved that are working predominantly in the other sectors. And in fact, colleagues like Marion Koopmans were key to putting the initial conceptualization phase together. So now that we're really moving into action, and which is generally a challenge of the whole One Health concept, is how do we move this concept that we all agree with to actual work every day. So the first point of entry that we have, one of the ideas for which there's an idea that there could be a community of practice is on issues relating to the animal-human interface for emerging pathogens, and how to think about that space and how genomics supports that specific issue. So within the groups we're clear on it, overarching always a One Health approach. So I think it will emerge as we start implementation.
And then Nick, there we go.
Thanks very much. Hi, Chikwe. Nick Grassley from Imperial College London.
Hi.
I had a question about the capacity strengthening and whether global supply chains were part of the global hub's work or part of the work of the UN system, because challenges in accessing reagents and supplies for surveillance activities, including genomics, is tough. And we've heard a few talks where, the cost and the timelines are really challenging.
Yeah.
Thank you.
Yeah, so this is a huge challenge, and even from my, one of the most hurtful things while working in Nigeria is having to pay for those multiple times what I knew colleagues were paying in countries where they had a lot more access to resources for the same items. And also just even when you had the resources sometimes just not being able to even access them. So it's not a direct responsibility of the group I'm working with, but it's one of those areas that has also risen in prominence in the role that WHO has to play. Not for everything, because we don't think we should be solving all the supply chain challenges, but in specific areas that are required for public health response. So there's a broader framework called the Health Emergency Preparedness and Response framework within which we come in, but there's a big part of that dealing on supply chain issues. And it wasn't something we were interventionist in any way historically, but now there's a realization that we have to define a space that is necessary for public health while not interrupting the markets per se. So how can we find where it's useful to be a player and what we should allow the markets to solve. So there's a lot of work going on in that space at the moment in what is called the post-Act A world, or what is the next thing after Act A, and how do we structure that. So watch that space is the best I can say. I don't thankfully have the responsibility to deal with it.
All right, we're going to be wrapping up. We have to wrap up, and I'm being told I need to wrap up. We got a question in the back there. Was it the hand? I'm not ignoring you. We haven't heard. First time I see that hand in the audience being raised. Is your hand being raised?
No.
Nope. You are not the last choice. Yeah. Please.
Thank you very much for the talk. And yes, this is absolutely a necessary thing. Even if it may not be sufficient to all the things we would demand of it, but it is necessary. One of the things that came up in the panel discussion earlier was the A word, agility, or pivot. And so I wondered if you had any comments on how you were going to enable that type of, or how this could help that type of agility, because there are times, for instance, when you might want to have a lot of more genomic surveillance in India, as when Delta emerged, thinking back. But I mean, I'm just curious as to what your thoughts would be on that.
So, thanks, and I absolutely enjoyed the panel and your contributions to it. To think about the word more generally, and in the notion of the hub in Berlin that we are putting together, I think the notion of the hub in of itself is a small demonstration of WHO's intention to become a little bit more agile in addressing some of these challenges and working with the global community to do so. So stepping away from IPSN on its own, everything that we're building at the moment is with the notion that we're moving slightly away from WHO as the source of all wisdom, if it was ever that way, but that is perceived to be that in many countries, as one that convenes as much as possible the global wisdom on issues, and together with partners, colleagues, find solutions on how to move forward. So in the physical space that we have in Berlin, we plan to occupy it ourselves to 50%. The rest of the 50% of the physical environment will be colleagues that have already started working with us on specific topics that we identify or collectively identify as important, so that we think together. All the work, all the projects we're doing are in one form of collaboration or another with with different groups. So, yeah, so I think if you can think about that word in many ways, but we are very conscious of it that it might have been an overused word through the pandemic, but there are probably good reasons why it was. And the more we can all include a bit of agility with others to work collaboratively on topics, I think we'll end up with the world in a better place, hopefully.
Chikwe, I think we will wrap it up there.
Yeah.
Thank you very much.
Thank you.